All right, hello everybody. I think it's time for us to get started here. We are in the session Child Parent Psychotherapy Expanded, Art Therapy for Caregivers, being presented by Ashley Skelly from Nationwide Children's Hospital. Ashley Skelly is a licensed professional clinical counselor and supervisor, LPCC-S, and a registered art therapist. She currently supervises the CALL program at Nationwide Children's Hospital, which provides mental health consultation to Franklin County Children's Services. She also provides treatment services through the ECMH program. Additionally, she facilitates art therapy groups for adults and adolescents living with epilepsy through the Epilepsy Alliance in Columbus, Ohio. Other clinical experiences include working with adolescents in residential treatment, adult patients with cancer and kidney disease, and children, adolescents, and adults in community mental health agencies with experience providing both outpatient and home-based services. She has completed training in child parent psychotherapy, trauma-focused cognitive behavioral therapy, and Incredible Years. Ashley has co-facilitated dialectical behavioral therapy groups with adult women and has developed and implemented various art therapy groups for both adults and children. She supervised counseling and art therapy interns, along with multi-level professional counselors. She has presented research at the ACEs, AMHCA, DATA, and Living with Epilepsy conferences. Ashley currently serves as the legislative chair for the Buckeye Art Therapy Association and spearheads efforts to secure art therapy licensure in the state of Ohio.
Thank you, Alex, for the introduction. Hi to everybody here and everybody on the call here as well virtually. I can't see you, but I appreciate you being here. So yeah, I'm here today to talk to you a little bit about some action steps that we've taken. Dr. Roy Wade gave an incredible platform, incredible foundation of why this work is important. And I was sitting in his presentation this morning and thinking, when he got to the slide about it all comes down to a nurturing relationship, I'm like, yep, that is where it is. And that's where this is all about as well. So I was really excited to hear how he was able to really emphasize the importance of relationships. And that's exactly what this work looked at, was just how can we emphasize the importance of relationships? We already know that through our work. How else can we connect caregivers? So that's what I invite you to kind of walk through today with me. I'll make sure we leave some time for questions because this is, I'd love to hear from, oh, I hit the microphone. I'd love to hear from you guys as well about your work and any ways that you see this being helpful in other populations. There we go. So I'd like you to just look at this image for a moment. And I wonder if you can consider where you relate, if you relate to the image on the left or the image on the right. Maybe you fluctuate day to day, maybe week to week. So this person on the left, this figure on the left, created some words that were identified as feeling the way this figure looks would be depleted, empty, spent, kind of feeling like there's nothing left to give. I'm empty. On the right, we see a figure that is fulfilled, full. They can be strengthened. Their needs are fully met. They're confident that they can be cared for because of what their caregiver has been able to do for them. So I just invite you to consider that as we walk through this, kind of a check-in with yourself of where you're at. And even if you're doing direct care work or working with others in our community, consider where you may see some of those needs being met as well. So let me tell you a little bit about art therapy before we jump into the structure of this group. So art therapy, for those who may not be as familiar, it's an integrative mental health and human services profession. It aims to enrich the lives of individuals, families, and communities through active art making, the creative process, and applied psychological theory. What we get from art therapy is that it's applied within the psychotherapeutic relationship, which has a parallel to child parent psychotherapy. There's a lot of triangle imagery you may see throughout this presentation. So really what we're looking at is, we know that therapeutic relationships between the therapist and the client are, the relationship itself is very important. With art therapy, we're adding the art into the relationship. And so we create kind of a triangulation response. The benefits of art therapy vary greatly based on what you're doing and how you're doing it. But some of the benefits include improving cognitive sensory motor functioning, fostering self-esteem and awareness, cultivating emotional resilience, which we've talked a little bit about this morning, promoting insight, enhancing social skills, reducing and resolving conflicts and distress. Again, there's that distress, there's that stress piece, and advancing societal and ecological change. So we really see the societal change as being a theme in today's summit. So I thought this was really appropriate. Now let me share with you a little bit about child parent psychotherapy, otherwise known as CPP, and I'll refer to it as CPP throughout this presentation. So this is an evidence-based model for early childhood. It's for children 0 to 5 years old and their caregivers. So it's a family therapy. It's dyadic, which means it's between the child and the parent. That's a dyad. There's two that make up that relationship, and it's very relationship focused. And the aim of anyone involved with CPP is to heal from trauma and any adversity. So simply the adversity of becoming a parent and having a child and sharing your home, that's enough for you to benefit from CPP. CPP aims to have similar goals to what we've cultivated here from Art Therapy. So the way we've crafted our group was we extracted some of the goals from CPP. We looked at how can Art Therapy maybe add something specific, and how can we combine the two? Is it beneficial? Will it work? In a group setting, let's look at some of that. So what we focused on with this CPP Art Therapy Group was exploring the caregiver experience through art, encouraging emotional expression through creativity, normalizing and validating the caregiving experience no matter where you are in the experience, increasing caregiver insight, reflecting on the impact of parenting on your life, identifying caregiver strengths, and highlighting the positive attachments that we see. We may have, in CPP, we may be seeing a parent and child who are thoroughly stressed with one another. We will still be able to find strengths, and we'll still be able to find how are they still connecting throughout the day. There are pieces there, and that's one of our big goals, was to find those. So over to the right, you'll see, I saw Dr. Wade made this little squiggle this morning, and I was like, things in threes. I'm all about the things in threes. So this was another way to sort of outline the goals of the group and the benefits. So by supporting a caregiver through CPP Art Therapy, they feel empowered and supported themselves. They then can rise up and go be with their child. Therefore, that dyadic relationship is strengthened. And then therefore, we're promoting child and resiliency and security for both people in that relationship. So again, to go back to Dr. Wade's presentation, we are just further strengthening the opportunity for those nurturing relationships that we know can help break the cycle of adverse experiences. So here's how the group was laid out. It was exclusive to Franklin County residents. So it was a grant-funded program. And we recruited any caregiver. So we made it very broad. It didn't have to be biological parents. It could be foster parents. It could be an aunt, an uncle, a grandparent, a coach, somebody who was caring for this child. For kids 0 to 6 years old. So we recruited from our program people that were receiving therapy already. We just let them know. We kept a flyer in the office and let them know, hey, this is available to you. If you'd like, invite your friends. If they're caregivers of kids, they can come with you. They can join you. So that was the only requirement we had. You had to be a caregiver of someone between 0 and 6 years old. And then the format was a little bit disrupted due to the pandemic. We had a group planned for 2020 and we had to cancel that group. It was early in 2020, so we weren't able to quite rebound quick enough to make it virtual. So from 2018, when we first piloted it, to 2019, we had 5 separate groups. And over the course of those 2 years, we had the group, the consistency was that the group ran once a week for 4 weeks at a time. It was 2 hours in length. It was an open group, so anybody could come. So if you could come one time, great, we wanted you to be there. If you could come all 4 times and then you wanted to repeat the next round of 4-week group, you were invited to do so. And then based on the number of people in the group, it varied. There was one day when I had one lonely person in the group, so it was just me and one person. And then most of the time we had between 3 and 5, and then the largest group we had was 6 people. So the way the group was structured, people would come in, they'd kind of have a seat. We had a large conference room area. And prior to the group starting, I had laid out art materials, a variety, all kind of around the perimeter of the room. So some of those art materials included collage. So these were magazines, also pre-cut words from magazines and pre-selected images that I had pulled out of magazines to save the choice. I don't know if you've ever collaged before, but just choosing can sometimes be an entire 2-hour process. So by selecting some of those choices, it can help open up the opportunity for more creativity and construction. So we had a lot of collage materials. We had some markers, stickers, crayons, colored pencils. We had clay available at every group. People were a little afraid of that, I found, but we always had it available. We had paint. It was acrylic paint, some canvas, lots of different kinds of paper, lots of cardstock, and then some just various scissors, glue, scrapbooking. So kind of like the elevated basic 101 art kit. So we wanted to include things that people were familiar with, but also new things that other people maybe wouldn't make time to do or didn't know how to do. So that was really our goal. So prior to the group starting, that was what it looked like. And then we would have everybody come in. When everybody was there, we'd just do a brief check-in. Anything you want to share? How you doing? What are you excited about today? Great. And then on a whiteboard, I would provide a list of prompts and different topics that we were going to be covering. Participants always had the choice to choose a prompt, or they could choose to do their whole own thing and they didn't have to do anything. This was their time to recharge, relax, to use the prompts if they wanted, or to do something else. I always gave an overview of the materials in the room, kind of walk them through, here's where you can find this, here's where you can find this, and then let them know that I was available to help them. If they had an idea in their mind, they weren't sure how to do it, that was part of my role, was to help them actually achieve some of their ideas or problem solve when we didn't have everything available. And then we spent most of the time just doing art. I let them kind of create on their own. They could focus on one thing, they could try lots of different things. And then at the end, we would come together about the last 20 minutes or so and just offer people to share what they did, what they created, how they thought about it. Did they use a prompt? Did they not use a prompt? So it was very much, you can share. You can also just pass and sit there quietly and listen. It was a lot of agency was involved with this group. So the prompts and topics, in order to meet some of our goals, were both caregiver focused and relationship focused. So we know the caregivers are in a dyadic relationship with their child that can be stressful. So we wanted to be able to offer an opportunity for them to explore that. We also wanted them to have a space to explore their own self as a caregiver. That's not always allotted when you have a child in therapy. You're often seeing the parent and the child together. There's not a lot of self-reflection the caregiver may be able to do. In CPP, we encourage a lot of parent-only sessions to kind of accommodate for that. And we may talk about some of these things in therapy, but again, it just depends on what the caregiver's time is. This was a unique situation where the caregiver, they had arranged childcare for their children and they were dedicating these 2 hours for themselves. So some of the topics, and we kept it broad, we kept the themes open. Caregiver focus were identity as a caregiver, what were their experiences like as a caregiver, and a concept called Angels in the Nursery. So I'll explain what that is. That's a CPP interview that really aims to have the caregiver reflect back on their early childhood experiences and identify who were their angels, who were the people that promoted positive attachment for them, who were the people that made them feel loved and safe and secure. So we wanted to explore that in this group and see how we could identify caregivers' history and how maybe that's impacting them today in their relationship with their child. And then with relationship focus with their child, we looked at just in general, what is the relationship like with your child? What are some of the challenges? What are some of the positive things that you have? What are some positive experiences you've had together, the two of you, you as a family? And then we also expanded some of this to be family mandalas or portraits. Mandalas are circular shapes that emphasize a picture, image, or multiple designs within. And again, just a reminder that they always had the option to create whatever they wanted. So we're going to let the art speak for itself a little bit here. I'll emphasize a little bit about what some of the creators, I have consents to share these images and some of these thoughts with you. But I'm going to go through some of the general themes, share some artwork that was created in response to those themes, and just let you have a minute to see what people made. So this first one is all about caregiver identity. This is a Collage Technique This participant used a lot of words, pre-cut words and phrases. I think they used a couple stickers, and they used some a couple images that were pre-selected as well. This participant shows that image of the old-timey painting with the crown and the silly ears as his role of explaining, you know, I have to be this structured figure, I have to be this father figure, but I'm trying to be playful. I'm trying to incorporate playfulness into my role. This caregiver he was a dad, and he had 3 kids, and it was a blended family. So he had he had 2 biological children, 1 with his current wife, and then he had a stepchild as well. He put all their birthdays on here, which I thought was kind of endearing. That's what all the months were, and used a lot of words. You'll notice the participants used a lot of words. I will just say as a disclaimer, I think that was a nice bridge between what was comfortable for them, processing in words, talking in words as adults, and maybe not having to jump straight into creating a blank painting from a canvas. That was a little too intimidating for some people. So we met him halfway. We said, we'll give you some things that are familiar. This is another one on caregiver identity. And this was a mom. She had 3 children with a blended family as well. One of her goals, she was a stay-at-home mom recently, and one of her goals was to start a YouTube channel and sort of incorporate her kids in doing child-friendly activities. So I think that was where the what it takes to be an influencer kind of thought came from, was how do I incorporate this as a caregiver as well? And there was a lot of focus on herself making changes and looking at the before I was a caregiver and after. This was another mom. Her child had autism, so most of her art had some reference to autism or special needs in it. She used a lot of animal images here. And I think her word choices really were relatable for most of the participants. This was another image created that same session with this same mom that you just saw the artwork from. So you can see an autism piece and a lot of words. She talked a lot about her own mental health, which impacted her as a caregiver. So you may see some words that can relate. We had masks, and one of the options for people to do is to create an inside-outside mask, which is a common art therapy technique. You kind of consider, what do I put out to the world? What do I show the world? What do I think I show the world? And then kind of what do I think I'm hiding or kind of keeping inside or keeping to myself or trying to hide, trying to physically mask. So this caregiver kind of did this, nice organized image on her front. She used some words, she used some color. She has kind of joy, shoot for the moon. That was some of her kind of hopefulness, optimism that she's portraying to the world. And then on the inside, she really had a lot of question marks, right? A lot of doubt. If you're a caregiver, it comes with a lot of doubt. Am I doing this right? Who would I check in with? How do I get guidance? But I really liked her words of extraordinary strength. So that inner peace for herself was what kept her going. This is another mask. So this one's a little busy. On the left side is the outside piece. There's an image up at the top that has a lot of overlapping hands. So I think it was kind of just depicting about how many people they're interacting with on a day-to-day basis, including their family members. And kind of that, we're trying to make memories. There's a word that says love, warrior, enjoy every moment is something that's above the eye there. And then on the inside, we have hands hiding the face. We have perfect, it's not perfection. So those are kind of conflicting, challenging thoughts that if you're a caregiver, you may relate to those. Messy, escape, Those are just some of the words that were used for kind of that inner, what am I holding in? This was a drawing created by another mom. She was also a teacher, so she was caregiving for children at her work as well as in her home. She had 2 children, and one of her children was particularly challenging for her. He triggered a lot in her, so she really used this time to explore what's going on in her head when she thinks about her identity. You can see she has wife, mommy, trauma. Those were some of the identifying words that she used. And then the other words were kind of more just what's in her brain. A lot of clutter, a lot of negative self-talk and critical views of her body and her kind of appearance. And then a lot of, up in the right-hand corner is in the red, it's a lot of what she was specifically responding to for her child that was challenging. So he was getting repeatedly suspended. I think he was only 5, he was little. So he was getting suspended a lot. Just a lot of threats, a lot of going to the ED because she wasn't sure if she could keep him safe. So just a lot of stressors right on top of, you know, all of these other identities she's juggling. And then here's some family portraits or mandalas. So some people, you know, decided to create a mandala, which is that circular image, and other people decided to just kind of do a general portrait. So this is one that kind of was both. They sort of included that mandala to hold the family. This was a single parent of a, I think, a 6-year-old and a 9-year-old. And she painted this. She challenged herself, I remember, in this one. She's like, I'm going to paint. I don't know how to paint. I'm going to try my best. And I really just thought that was a really telling way to show I feel safe in this group. I'm comfortable with trying something that I don't do all the time. This was someone else's family portrait. They used all words and just talked about a lot about the different words that describe their family members. This was someone who had been through the group multiple times. Actually, I think she did a total of like 10 sessions. This was her kind of expanding. She really liked collage. And so she had put multiple papers together to really kind of enhance her skills. So I also saw her confidence in herself growing with every group that she attended. And in this one, she included images that reminded her of her children and herself. Another family portrait. Using symbols to describe things that were important in their family values and makeup and how they enjoyed time together. They were a big superhero family, so she put a lot of superhero in her art. This downloaded in a strange way, but the content is there. So this was actually a rectangular canvas that was split into a sort of 3 quadrants. So up on the left-hand corner, it was a patchwork quilt of the Disney movie Coraline, which was one of her children's favorite movies. So she was honoring them by kind of talking about one of our favorite things to do is watch movies, and they really like Coraline. And then we had to the right a symbol of Beauty and the Beast. That was her other child's favorite. And then where it got kind of wonky was at the bottom where there's not, it's just the white part with a drawing of a seashell. That was the beginning of her creating the Little Mermaid, which was her favorite. So she was kind of putting herself and her kids all together, kind of this, we have individual interests, but we come together and share this experience. And these were different creations created over the course of the various groups that were just response to anything that we talked about, the relationship between you and your child. So just wanting to explore, what does that look like? What does that feel like? This was a mom She was struggling with a lot. She did another image that we saw today. She's with her son, who she was really struggling with, but had a lot of hope for. She was actively really working in therapy to try to repair the relationship. So she kind of has them in a bubble, in a kind of protected area. And around the branches of her image, she has a lot of kind of self-talk words. So I'll read a few of those for you since they're small. But these were things that she told herself when things were really hard. So she said, what are you grateful for? Feel your feet. Mommy loves you. Look at the beauty in the world. Listen to your breath. Focus. Notice your surroundings. And then all around her were kind of those branchy, prickly things of all the things the child would say that would hurt her. This parent came to one group and she spent time kind of making signs to hang up in her house. So when kind of prompted to think about her relationship, she was kind of thinking about these positive mantras to share with her family. So she made a series of images during her time in the group. She had a blended family. She said, we aren't step, we aren't half, we're simply family. We must always love each other, even when we don't like each other. And this one said, we're all a little mad here, which is a quote from Alice in Wonderland. And then it said, it's not a competition, which was funny. This was someone else that decided to make kind of a sign for their family that said, why fit in when you were born to stand out? So another quote. And thinking about the differences in her children and how she saw kind of their colorful family come together as a unit. And then the angels in the nursery, this was when we prompted caregivers to think about their positive experiences with a nurturing caregiver. And so these were some of the responses that we received. This was an image of a caregiver rocking a baby and music notes around to symbolize kind of rocking and singing. So that really early childhood memory. Sometimes people don't know that you can remember when you were an infant, but preverbal memory is very strong. And I always find it interesting when it can translate into imagery. This one's a little hard to see. This person worked very hard on this, so she didn't get to complete it in one group, but she was remembering the ritual of her mom tucking her in at night. She had a stuffed animal next to her, and she was really remembering the details of her room and feeling safe to go to sleep at night. So that was her angel in the nursery, was her parent, but also her space that was created by her parent to help her through the night. This was a mom. I loved this story just because it really shows the benefit of how the angels in the nursery asking those questions can really elicit really meaningful memories for caregivers. So this was a mom who she really struggled with when she thought about, early childhood experiences. I don't know. I have a tough relationship with my mom, my parents. It's hard. I don't know. Let me think about it. So she really kind of struggled on what to do. And then she worked really hard for a while, kind of quietly. And then when we came together, she said, I remembered, I haven't thought about this in so long, but I remembered that my grandpa, so she was focusing on her parents and she was having a hard time. Then she remembered her grandpa. He used to make me into a comic, and I was this little character named Captain Ketchup, and he used to draw me comics, and that was some way that we connected, and that was a way that he made me feel special and loved. And I think she surprised me because she surprised herself at how she I don't think she was even conscious that memory was still in her brain. And this was a really nice way for her to spend some time reflecting and just kind of honoring that experience with somebody who was really special to her. I could have gone on and shown you all the beautiful artwork and incredible artwork that people made, but that's just a sampling. What you might notice, I'll kind of go over the themes, but just because those last three images were about the angels in the nursery, early experiences, those did not have words in them. Those were not heavy on collage and heavy on words. When we talked earlier about how do you identify yourself, how do you, using prompts that really we talk about in therapy, a lot of word heavy came out. So I just wanted to make that difference, that sometimes when we go really far back in our memory, our preverbal memory remembers things through tactile, sound, other sensories. We don't have words yet when we're infants, so we remember in different ways. And those last few images just honored that preverbal memory. So I just wanted to draw some attention to that. So themes. Really what we see is that there were relationships in every image that was created. Even when we asked, how do you identify as a caregiver when it's about you? And we would hear from a parent about all the struggles and challenges that they're facing. We saw the relationships in it though. We saw that one caregiver identify, I'm a wife, I'm a mom, I'm a teacher, I'm in all of these different relationships that's causing me stress. So relationships was really the key in every single response, no matter what the prompt was. And what we saw was, to the right here, we saw that we were looking at relationships with our kids, with our partners, with our support people, historical and current, and with ourselves. Some of the other themes that came out was we saw a lot of different kinds of feelings experienced as a caregiver. We saw people expressing joy and positive experiences and remembering those things. We saw people expressing pain and challenges that come, and sometimes they coexisted. They were happening at the same time. We saw identifications of judgments of the self and of their children. We saw a couple images that honored their special needs children. There was a lot of discussion that would happen during the sessions about what's it like, how am I viewed when I go out in public with my special needs child and they have a tantrum? How am I viewed when I have to go to the school to pick them up early because they're being asked to leave? So there was a lot of judgment there, discussion that was there. And a lot of reflections on parenting values and being cared for as a caregiver and also being a caregiver. And really the overall theme that I saw with the reflections given back to me from the feedback given back to me from the participants was that the connections that they made through their discussions and through sharing their art was the number one takeaway, the number one positive takeaway from these groups that happened. So here's some feedback. We collected actually quantitative and qualitative data. The quantitative data was in the office, and during the pandemic when things got shuffled around, it got lost. It is still there somewhere. We're working on obtaining it. But I did have some of my, I was able to find some of the notes I had taken during the group that was just kind of hearing what their feedback was. So we see a couple themes here. We see there's time to get away and take care of myself, so that replenishment. We see thinking, reflecting, that so they're actively using their brain to increase that insight and expression. Being yourself with no judgment, meeting moms who understand what you go through, so that non-judgmental approach. So these were all different, people said these things in different ways, but these were some of the kind of the key quotes that I took away. And then I also created a word cloud based on some of the other words that we got. We always ask participants at the end of the group to give us 2 to 3 words about how they were feeling when they left the group. And these were the majority of what we saw. So happy and relaxing were the number one feelings, takeaways that they were leaving with. We see another mix of just feeling understood, feeling fulfilled, feeling rested, peaceful, calm. Those are all things that we want caregivers to have access to when they're dealing with challenging behaviors with their children and their own adversity and struggling through their own stressors. So they were able to find that through this group experience. We also see a couple ideas that indicates that they were thinking about things. There's, I feel different. I feel centered. I feel determined. So there are some things that indicated that they were kind of working towards a goal here and that there was something more happening than just a fun art activity. So let's come back to this image. We have this image of this caregiver who has given everything to this child who needed a lot. This child had a lot of cups to be filled throughout the day. The caregiver and the child are both smiling. The caregiver is happy to give to their child. They want to give to their child, but now they're left feeling empty. So how does this caregiver get replenished? How do those metaphorical cups get refilled? And here's just a couple ideas coming from this group. Art is a great way for people to sit by themselves, reflect, enjoy, find a sense of calm. Art taps into various parts of your brain that we don't usually access on a day-to-day basis. So art is a great way in a group or in solidarity to kind of replenish yourself. Holding space is another great way. You can do that as a friend, you can do that as a caregiver, you can do that as a therapist. You can hold space and allow them to be where they are in that moment. Making connections was definitely one of the big things that was important to these caregivers. Connecting with other people who get it, who understand, who they feel like they're not being judged, and they feel like they can say, yeah, me too, me too. They don't get that on a day-to-day basis. Using different parts of their brain. We really want to emphasize that for caregivers who are usually in task mode almost all day long when you're caring for young children, especially. It's what do they need to eat? How do I prepare it? Where do they need to go? When do they need to go to bed? It's on. You're only using one part of your brain there. So we just really want to incorporate other opportunities to use different parts of your brain. And sharing with other people. That's sharing with other people who care. It's really important to be able to share your ideas with somebody, feel listened, feel heard, and be able to reciprocate that. That also feels good. This last quote is something I want to kind of leave you with here. We are less lonely when we connect. Art is connection. So the takeaway of this experience of this group was that we know that relationships are one type of connection, and we know that relationships heal from adversity. Any opportunity we can have for caregivers to safely connect and share and find meaningful connections is a good thing. It's a positive thing. We ask a lot of caregivers. We don't want to ask them for more time if something is not going to benefit them. So we find that through this art therapy process, it's a different kind of interaction. There's no expectations. It's come, be here, do what you need to do in this space. And what we find is that they actually did want to connect. They actually did want to make that time. So I will open it up for any questions if I have time. It looks like I have time, a little bit of time.
Yes, you do. I was going to say the breakout rooms were accidentally set for 45 minutes instead of an hour.
Oh, okay,
so
okay.
In about 2 minutes, we're going to be
Kicked out.
We're going to be putting everyone back into the rooms to continue the session.
Okay, okay. Well, in the meantime, if anyone has questions, I don't know if there's a way to check the chat or to exit out of here.
I have been checking the chat here. There are not any questions yet. But yeah.
Okay.
Does anybody here have any questions?
Yeah.
Do you know if there's any programs locally for master's degree level art therapy?
So say that again?
I haven't looked lately, but I went to school. They didn't have it.
Yes. So there is not one local. There's only one master's program in Ohio. It's Ursuline College. There is a hopeful process of developing one at Capital University.
I got it there. My undergrad in that.
I did as well from Capital. Yeah. So it's a hopeful process. It's been in process a while, but it definitely seems very plausible. Capital just also created their first counseling graduate program standalone there. Maybe not their first ever, but their first in recent time last year. So I know that there's a focus kind of looking at the helping professions and expanding. Yeah.
One question I had was, what sort of quantitative data was collected?
Yes, there was a Likert scale survey that was created that was sort of a pre-post. So when you came to the group, you would fill it out. And then before you left the group, you would fill it out. And it was just a few questions. I wish I had it to share with you. It was a few questions just about kind of checking in. How do you feel? How are you doing? We had the DOS, which is another measure of relationship scale. It's something that the Positive Parenting Group uses, which is a Cpp group. So they have a couple measures that we pulled from to see, do these apply? One scale was the DOS, which was about the relationship. So kind of asking questions about how confident are you in your relationship? How positive are you in your relationship? And also asking questions about how you're feeling, kind of looking inward for the parent. So a level of depression, levels of connections with their partner, being unhappy or feeling like they're co-parenting well. So some different measures that were just Likert scale based to get some pre-post information. And we are planning to do this group again next year, several times, and we'll start over if we have to, but hopefully be able to compare.
And I do see that I do see that there are some questions in the chat.
Okay.
But we will get to those once the rooms are
Okay.
back in session.
Okay. So we'll be kicked out and then let back in?
Yes.
Is that the plan? That's the plan, everyone. If you can hear that and hang.
No, but I do have the questions.
Okay. Can everybody hear me again?
The chat was saved, actually.
Oh, it was, cool.
Yeah. So yeah, the questions started with.
Oh, great, okay. Okay, so I'm looking in the chat and I am going to start with Kelly Steele's question. So from a program development perspective, what's your experience getting payers to reimburse individual and group art therapy sessions? So I was already in the early childhood mental health program at Nationwide Children's is already structured as a reimbursement insurance repayment for individual and family therapy. That specific program does not have a structure for group art therapy. I'm not even on a video. Sorry, I realized you could not see me. Okay, so the therapeutic program we were doing this group through was funded by, was able to be insurance payment for the individual therapy. But for the group, we just had a grant. So there was no payment for the participants and we didn't have to collect any sort of notes or data from that area. But as far as getting payers to reimburse individual and group art therapy sessions, because there's no licensure in the state of Ohio, this is on an art therapy standpoint, that because there's no licensure for art therapy in Ohio, there is no ability for insurance to reimburse at this point in time. So that's why there is an active bill. There's actually 2 active bills in the legislature right now that's looking at art therapy licensure simply to expand access to care and assist in promoting, best practices and being able to get people to affordable health care. So that's what's happening now. And then there are several, art therapists that we do a lot of grant funded work, but there are some people that just take self-pay and like private practice. That's kind of the workaround right now. Some art therapists in the state of Ohio are dually licensed as a social worker or a counselor like myself. Some of those people are in private practice and are able to apply their appropriate training in art therapy through their counseling work. And sometimes that's a way for insurance, but it's kind of, that also comes down to kind of an ethical and scope of practice issue as well. Kelly, if you have any other questions about that, let me know. But I see Felicia that said, when do these classes reopen? So we're working on next year in 2022, finding a time to offer this. It would likely be advertised through Nationwide Children's Hospital in some capacity. I'm not sure if we'll be able to post it on social media or if we'll be able to advertise kind of on their website, but that would be the best way to inquire about it. And if you're in Franklin County, that would be, kind of the only qualifying factor. But we don't have any details about like days and times and structure quite yet, but we're working on it. And then Kelly also said, are you familiar with art therapy curriculums for adults recovering from substance abuse disorders? There was a moment in time that I know CompDrug had an art therapist on staff and they were doing art therapy programming there. I don't know if that is still the case. That was probably 2.5 years ago when I knew the art therapist that was working there. Other than that, there are no set art therapy curriculums, although there are lots of people in Ohio that are art therapists that work with the substance abuse and addiction population. So I know there are benefits found. There's some good research studies that exist on the national level about art therapy and addiction and recovery. I definitely encourage you to look into that. The American Art Therapy Association would have a lot of great resources, but it is something that I think is so beneficial. And I've found when talking just kind of side to side with other art therapists in the field that that's such a nice adjunct to other recovery programs and techniques. And Kelly, I'm just reading you're an LASW. Absolutely. Yeah, and I mean, I'm happy to share with you, Kelly, more information. I don't know how you can get in contact with me. Actually, I didn't include my contact information, but can I write it in the chat?
Yeah.
Is that fine? I'll write my email in the chat if Kelly, if you want to send me a message and we could chat more about that. So Kelly asked also a really good question. So with appropriate art therapy trainings, we can use art for psychotherapy, similar to how we use CBT in therapy, not licensed CBT therapists, but using those techniques all the time. It's complicated. So art therapy does require a training track and a master's level degree, simply because there's a lot of art therapy theory and technique and things about materials that just are not covered in a counseling, social work, marriage, and family therapy track. It's almost comparable. Like, I went to school for this, but there's a lot of overlap in therapy, right? So we naturally do a lot of interventions and pull a lot of interventions when we're appropriately trained. So doing art in therapy makes sense because, especially if you're working with children, right? That's how they communicate. So I encourage people to use art within your scope of practice. Usually what I find is people that are using art are using a different model in theory. They're using art as the supplement to get to that theory. Art therapy theory is kind of allowing the art itself to be a part of the therapeutic process. And there's not necessarily a verbal, there doesn't have to be a verbal insight or a verbal deconstruction attached to it to make it meaningful. I hope that makes sense. It's very complicated. Again, refer to my email. If you have more questions, I can talk to you more on a personal level about it. Did I do okay with that?
I think we have time for one more question if anybody else has anything to ask.
No.
In the chat as well.
Yeah, if there's one more question, and otherwise we can give people like 5 minutes to stand up. That's also a beautiful gift. All right. Thank you all for attending. Please, take my email down and reach out if you have any other follow-up questions. And I'll hand it over to you.
Of course. Thank you all for, there we go. Thank you all for attending this session. The next session in the summit will be a 15-minute break from 2 to 2:15. On this Zoom link, we will be presenting a series of videos for you to enjoy from youth groups. And following that, starting at 2:15 and from 3:15 on the Ohio University Zoom link that we sent out, we will be presenting the panel discussion and closing remarks for the summit. Thank you all for attending, and we hope to see you there soon.